Welcome to the 2020 Medical Innovation Forum. It's our sixth annual forum, but it's our first virtual forum. I'm Scott Sperling. I'm chairman of the board of Mass General Brigham, formerly known as Partners. We're a system that was founded by Brigham and Women's and the Mass General hospitals, and it's now grown to 14 hospitals with 1.5 million patient visits a year. We're the largest academic research enterprise in the United States. We have more than 6,000 members of our faculty who are also faculty members at Harvard. And we have a team of 78,000 caregivers and colleagues. It's my pleasure to welcome each of you to this extraordinary event. It's focused on innovation as it relates to COVID-19 and how it will impact the future of medicine. This has been an unprecedented time for all of us, and especially for our frontline caregivers. I'm so proud of the way the entire organization has answered this critical call. The work that we're doing both clinically and in research is amongst the leading work being done in this country and, in fact, globally. It's my honor today to introduce Dr. Ann Klibanski, who is our president and CEO of Mass General Brigham. I've been privileged to work with Ann even before her ascension to CEO when she was the chief academic officer. She also was the head of neuroendocrine at the Mass General Hospital, so a very busy individual. She is an outstanding leader of this very large and diverse organization. She is an outstanding academic, and she's an outstanding clinician. So Ann's leadership has been never as important as what she has done during this period, where she has steered our organization and all of our people through this incredibly difficult time. And in fact, to a point where we believe that there will be significant breakthroughs made not just in COVID-19, but where our entire system is poised for a point in time when there's a return to normalcy, where we can continue to do the great research and the great clinical care and the great teaching that we are known for. So again, it's my privilege to introduce Dr. Ann Klibanski.
Thank you so much, Scott, for your kind words and your spectacular support and leadership of this organization. It has been and continues to be my great privilege to work with you and the entirety of Mass General Brigham. So good morning, and thank you for joining us at the 6th Annual World Medical Innovation Forum. On behalf of all the employees of Mass General Brigham, welcome to this virtual event. This year, in the unprecedented setting of this worldwide pandemic, we will examine the ways that COVID-19 and our response to it has and will continue to alter medicine, the delivery of care, and the way we all live for the foreseeable future. This forum is rooted in the belief that a dynamic, evolving healthcare system is defined by a shared fundamental commitment to collaborative innovation, industry and academia working together to improve health and the lives of people. No collaborative endeavor is more pressing or critically important right now than responding to this COVID-19 pandemic. This year's forum explores the technologies driving the response to coronavirus and ultimately our ability to achieve a healthy and safe life shared with friends, coworkers, colleagues, and families. Many of these new technologies have already been adopted, and others are under development. Some are currently meeting urgent needs, and in that urgency, we have seen progress made collaboratively in areas that may have taken years in other times. And I would just hold that thought, because I'll be getting back to it at the end of my comments. Other innovations will profoundly alter how healthcare is delivered now and also in the future. This gathering examines these technologies, digital, diagnostic, prophylactic, and therapeutic, that will be so critical. They are so critical in the battle against this pandemic, and will also help us shape a future state built on so many new and in some cases, revolutionary models of healthcare innovation and delivery. Thank you for joining us. You are part of a virtual community now of more than 10,000 people from 45 states, 87 countries, and 3,000 organizations. Today, principals, industry, government leaders, our own Harvard faculty will discuss their firsthand insights, perspectives, and often aspirations. And as always, our focus is a spirited person-to-person exchange of ideas. There are no slides throughout the day. This is really person-to-person interchange. We are so grateful to the more than 60 clinicians, senior executives, investors, and investigators who will share their insights together today. A thank you to our sponsors, representing some of the most innovative companies in healthcare, including Bayer, GE Healthcare, Biogen, Boston Scientific, Fujifilm, InterSystems, One Medical, and Siemens Healthineers. Thank you all. And a word of thanks to our steering committee, and especially our co-chairs, Dr. Greg Meyer, Mass General Brigham's Chief Clinical Officer and Acting President of Newton Wellesley Hospital, and Dr. Ravi Tadani, Mass General Brigham's Chief Academic Officer. You are both so valuable to the continued success of our forum and our organization. I would also like to thank Chris Coburn, our Chief Innovation Officer, and his planning team for this truly superlative gathering forged over the last 8 weeks. Most importantly, I want to recognize all the COVID caregivers, not only at Mass General Brigham, but on the front lines everywhere, from first responders to patient care providers to those working behind the scenes. We are so grateful to everyone's contributions to this battle. And most critically, we acknowledge COVID patients and their families around the world, and dedicate today's gathering to the continuous improvement of patient experience and outcome. So benefit and find energy from the World Medical Innovation Forum, and we very much looking forward to seeing you next year. But in conclusion, I want to end with this challenge. How we do, and this is our collective challenge, channel the purpose, that energy, that rapid progress and efficiency born of this crisis into rethinking our approaches to so many other diseases that have and will continue to take such a toll on human health. That is one of the most significant things that we need to be thinking about for our collective future. So with that, I turn to Greg Meyer, who will now moderate our first session and introduce the panelists.